Okay, hello, hello. Hi. We are finally getting to our treatment options. And so here in this module, we will talk about non-prescription therapies. Okay, so the next module will be all about prescription medication, but this one will be about non-prescription therapies so that you can just have an overall idea of what you can do without actually going to see a provider. Okay. And of course, there's the disclaimer and disclosure. Remember, this course does not serve as medical advice, it's just for educational informational purposes. Please use this information wisely and talk to your provider, your own provider, about your symptoms, your risks, and what you would like to do in terms of treatment. I also want to make sure you know I don't get any money from any drug company or radiology imaging place or laboratory. So anything I recommend to you is just my own recommendation. Okay. So let's first talk about, well, we talked all about the potential symptoms. So let's remember the symptoms are varied, and I'm not going to be able to cover every possible symptom that you could have in this lifestyle approach. So this is kind of the general lifestyle approaches that you could take to perimenopausal symptoms, as well as reducing your risks that are associated with menopause and with aging. So, number one, I know it gets so tiresome. Diet and exercise and maintaining a normal weight or near normal weight or losing weight. So, when I say diet, I don't mean to restrict, overall caloric intake. That might be what you need to do to lose weight. But what I mean is eating a healthy diet. Many women find that with hot flashes and night sweats and irritability, moodiness, and even insomnia, that if they avoid certain foods, they actually feel a lot better, particularly sugar related foods. Some women feel, and there is some basis to it, some women are very sensitive to inflammation that might be related to dairy products or other food items. I know that there are anti-inflammatory diets that you can try, especially if you're having joint pain. So, like for arthritis, you could try one of these low inflammatory diets, which might include excluding certain vegetables, even and certain fruits, even. So, definitely reading about different diets is helpful, but the main things when it comes to hot flashes, night sweats, mood swings, irritability is avoiding sugar. You want to keep your blood sugar stable, okay? And if you eat something sweet, especially you could have something naturally sweet like strawberries, let's say, which have a lot of fiber, but they have a lot of sugar. When you have something that is naturally sweet that still has fiber in it, your blood sugar doesn't shoot up as much and then drop. And it's that shooting up and dropping that can contribute to hot flashes and night sweats and also to irritability. So, trying to stick with a diet of whole grains and whole foods and not processed and avoiding sweets. That is actually probably, if you're motivated to fix your symptoms with diet, that is the place that I would start. Exercise is important. It's long been known that if you're having mood symptoms, whether it's anxiety, irritability, or depression, that cardiovascular exercise or any exercise where you're really exerting yourself, which can include resistance training, exercise is going to make you feel better. There's certain endorphins which are released when you exercise. So, exercise and dietary changes, those are the things that are going to help you naturally. Exercising, when you do cardio regularly, it actually helps with sleep. So I recommend that. Weight management, of course, that goes hand in hand with the exercise and eating fewer sugars and eating healthier overall. Getting your weight into a normal place, that can also help with some of these symptoms, especially inflammation symptoms, joint aches and muscle aches that can be related to perimenopause and menopause. Okay, so it takes a lot to do those things. If you are dedicated and focused and you have the time in your day to exercise, I would like everyone to make the time no matter what, to make the time to exercise every day. think, like I said before, if you could even do 10 minutes after each meal, that would be great overall for your overall well-being, not just for keeping blood sugar stable. And then the second point here is alcohol and smoking cessation. So it's hard for a lot of people to completely quit drinking because it's something that they do socially. You go out to dinner with friends, or you're having dinner, you're having, social time, but really to moderate that. Try to limit your alcohol to 1 to 2 drinks in a week, and smoking, just completely quit smoking. Easier said than done if you're a smoker. If I were you, I'd reach out to your provider. There are medications that can help with smoking cessation. Um, Alcohol, I will say I've had a number of women who come in to see me with all these symptoms and their irritability and moodiness. And I guess to cope with things, they've been drinking a lot more. And that's also contributing to their weight gain. So having, 1 to 2 glasses of wine an evening or more, half a bottle of wine or to a whole bottle of wine every evening, or whatever your drink of choice is, that is not healthy. It's promotes all sorts of chronic diseases, and on top of it, it's extra calories that are just carbs, simple carbs that get deposited right in your tummy. um, Alcohol, I didn't really discuss it in the cancer talk because I was talking about individual cancers, but alcohol intake does increase cancer risk. And there used to be a thinking that alcohol reduces cardiovascular risk, like having a glass of wine, but that has not really, in more studies, that doesn't really seem to be true. So there's really no health benefit to drinking. Okay, I know it's sad to say, right? Okay, well, we talked a little bit about some of the things to cut out. For some people, it's easier to pick a diet that they can look up online. Like I said, an anti-inflammatory diet, Mediterranean diet, which would be a lot of vegetables and whole grains and fish, uh, lean proteins. And then we talked about the exercise. What kind of supplements can you take? Well, in general, to keep your bones healthy, if you're not going to take something else, to a hormone, for example, to prevent osteoporosis, then making sure you're getting enough calcium in your diet, or taking a calcium supplement plus vitamin D. And depending on where you live, you may need more vitamin D. Um, Usually, you don't need to check your vitamin D level. I usually just assume in the winter that most people aren't getting outside as much unless you live somewhere sunny. And so take a vitamin D supplement, even 2000 IU uh, per day. And you just want to make sure you're taking the vitamin D supplement with food that has fat in it, because it's a fat soluble vitamin. It doesn't really absorb if you take it on an empty stomach, or if you take it, let's say, with fruit, something that doesn't have fat. So you want to take it with, let's say, your meal, your dinner, or your lunch, or whatever, breakfast, whatever you're having that has fat in it. There's been studies looking at phytoestrogens, like soy-derived estrogens, for vasomotor symptoms. So some women will drink soy, or they take a soy product, over-the-counter product. There have been extensive studies looking at soy and reduction in hot flashes. The thinking is that, why do Asian women have fewer hot flashes and not as bad of vasomotor symptoms? And maybe it's because they have more soy in their diet. But the studies don't seem to have shown that drinking soy milk, for example, will reduce your risk of having vasomotor symptoms, hot flashes, and night sweats. So now I will say, in terms of a plant-derived product, I mentioned this in one of the other modules, but I have recommended and seen a lot of improvement taking a plant extracted progesterone that they sell over the counter, whichever website you like to order from. And so progesterone cream that's plant extracted, and that they usually extract it from yams. So And that seems to help give you a little bit of progesterone in your bloodstream to kind of balance out. So I've had a number of women have improvement with that. I don't have a specific study though to show you or to tell you about. Black cohosh has been studied and there's kind of mixed evidence. I will still recommend it if someone's really trying to avoid going on to any hormone therapy. I will recommend trying black cohosh. And usually you have to take it multiple times a day, which is kind of the hard thing to take because anything that's more than once a day can be a challenge for some people to manage, to remember, to have an alarm set or to have it with you at work. And you just don't want to take, overdoing it. I think there's been some question of if you have a liver condition, not to take black cohosh. But otherwise, if you're otherwise healthy, it's fine to take black cohosh to see if that helps your hot flashes or night sweats. It doesn't really help with other symptoms. Omega-3s are a supplement that a lot of people take. It's basically like substituting for fish oil. And this is going to give you some anti-inflammatory effect for your blood vessels that you would be getting from estrogen. If your estrogen levels are decreasing, remember we talked about the anti-inflammatory effect of estrogen on blood vessels. It promotes suppression of certain inflammatory markers or chemicals like TNF alpha and interleukin 6. So the omega-3s do the same thing. They kind of suppress that. So that's pretty much what you can do that are kind of supplements. I'm sure there's a lot of other ideas out there. I don't want to discount any other thoughts that someone might have for supplements, but there's not really hard data on any of them to support it. There are studies, and a lot of them are from Europe, which is they keep much cleaner, like very concise registries of different supplements in European countries, but the studies don't seem to show a statistically significant difference in symptoms from any of these over-the-counter supplements. Okay, so talking about genitourinary syndrome of menopause, which we talked about early on, and how can you treat that without a prescription? Well, certainly you want to maintain some sort of moisture in the vagina, and there are great lubricants out there. There's a number of lubricants. Replens is one of them. There's a few different branded lubricants you can get. I am not opposed to and that's just a personal lubricant. Then you want lubrication for when you are having intercourse, and there are silicone-based lubricants. The reason that generally those are advocated for is because it's thought that they're less likely to alter the microbiome in the vagina and then lead to infections or a urinary tract infection. That's the thinking behind using a silicone-based vaginal lubricant for intercourse. There are various oil-based lubricants. You could use oil. You could use coconut oil, but you can't use those if you're using a condom. Condoms will break down when they come into contact with oils. So that's the other reason to stick with the silicone. If you're not using condoms at all, I really have had great success with numerous patients using coconut oil as a lubricant. It's for intercourse. It maintains the slipperiness, whereas a lot of the lubricants, the silicone-based, are great at first, but you have to keep applying more. So I think the coconut oil, your male partner can put it on his penis, and I would also have you put it on your vulva so that all the friction, there's no issue with friction, and there's plenty of slipperiness. So is that really a word? Okay. You want to maintain the vagina. So talking about vaginal maintenance, if estrogen is decreased in the vagina, the concern is if you're not having intercourse, the vagina is going to close up. It's going to tighten up. It's going to become more stenotic. That's why it's a stenosis. So what do you do to keep the vagina open? You need to use something inside. So if you're not having vaginal intercourse, then you want to use a dilator or a sex toy, a dildo or vibrator that you can insert into the vagina to keep the opening open and stretched out. Keep in mind, without estrogen, the tissue is not going to be as stretchy, and it may be more brittle, the tissue. And also, during intercourse, it may be more prone to tearing. So these are issues with non-hormonal treatments that they may not be effective. I also coming back here, I want to make sure you remember, preventing urinary tract infections. You want to go to the bathroom, preferably, especially if you don't have a lot of lubrication, you don't have a lot of estrogen there. I would recommend going to the bathroom before and after intercourse. There are some supplements that some people take to prevent urinary tract infections, like D-mannose. There does seem to be some studies showing that can be effective. Also, cranberry juice. Drinking cranberry juice can reduce risk of urinary tract infection, which is one of the problems with genitourinary syndrome of menopause. So it's not just lubrication, it's bladder symptoms. So what are some other things that could help with some of the vasomotor symptoms, the mood symptoms, maybe sleep? And actually, a lot of these things can work. Acupuncture, the studies are kind of mixed, but I've had a number of patients have improvement with acupuncture. And I think acupuncture, it really varies on who's performing the acupuncture and how skilled they are, how well they know the correct points to apply the needles to. Yoga and meditation. I can't say enough for both of these, particularly for meditation. I recommend there's a free app called Insight Timer, and you can learn how to meditate on there, and using meditation to learn how to reduce your stress level in the moment when you're experiencing a lot of stress, or reducing stress before you fall asleep at night, or reducing stress in the middle of the night when you wake up and you can't fall back asleep. That's where meditation can really be helpful. If you are one of those women who are having hot flashes when you are stressed out, learning meditation and how to kind of control your body is really effective. The uh, same with cognitive behavioral therapy, which is really helpful for mood and sleep issues. It really helps with stress. So that's something you would need to learn from a therapist, but it can be really helpful with a lot of these symptoms. If I was getting a hot flash every single day when I was getting stressed out, getting in the car to start driving because it's a stressful time. So learning to center myself and to calm myself. I think that's very, very helpful. I still use breathing techniques for stressful situations. Cannabis, if you live in a state where it's legal, then you may try going down to the cannabis shop and seeing if you can get something for helping with sleep. There are definitely some treatments there. Some people use, rather than like an actual something that has a certain amount of cannabis in it, maybe even just a CBD product, which is a lot lower level, and that helps to some people. But you don't want to end up being dependent on that. But certainly it's an option. There's just not the evidence, long-term evidence on it yet. Okay, well, that's kind of the general, non-prescription options, which I think there are a lot of things. And I actually think a lot of the non-prescription treatments are useful things to do, even if you do go on something that's a prescription. So even if you're going to go on a prescription hormone or non-hormonal treatment, you want to learn how to handle stress without getting stressed out. How to control your breathing and your stress reaction in your body. You want to be taking a vitamin D supplement and calcium supplement because most likely you need it going into menopause. There's so many things that we talked about that you may just want to learn to do. You want to exercise, right? You want to eat healthier. You want to get your weight into a good place. You don't have to be, necessarily BMI, body mass index, of 25 or less. But at least be in the, less than 30, right? If you're over 30. And if you're already in the 26 to 30, maybe then you shoot for being 25 or less. But the idea is that you want to be your healthiest self as you move through into menopause and have, another, potentially 40 years of life as a menopausal woman. Okay. Well, we'll see you for the next module.